how do I know if my horse needs to visit an equine dentist?
Wonderful question. What you've got to do is you've got to look at your horse and watch your horse eat. When he starts to turn his head so his lower jaw is upside down, you know you have a malocclusion in his mouth that you need to address. So you have to watch your horse. Then the second thing we have to look at is when you pull the lips apart and you look in, you have to address where the lower teeth and the upper teeth fit together. And when these molars fit together and they meet, it's wonderful. When the upper tooth is longer than the lower tooth, that's a rostral profiling, and it will readjust the lower jaw to the upper jaw, and they will always not be in balance. We have to, as people that address, we have to look at our horse's structural conformation of its head and then assimilate it to be the most comfortable that we can make it. And it is wild to watch. There's four different conditions that happen. We have the molars in the front meeting the lowers and the bottom meet together and they align. And then we have the upper molars meeting ahead of the lower molars and causing a rostral profiling. And then we have a third occasion where we have an excessive amount of lower jaw narrowness, where the lower jaw actually sits inside the upper, and the lateral excursion is a real effort for them to meet. And it needs to be addressed as each individual needs to be addressed, and each case needs to be looked at individually. It's a wonderful project.